All right, we will move then to item number 12, discussion of issues related to COVID-19.
Thank you, Mr. Mason. I'm back.
Chief Gray.
Alrighty, so we're just going to give an overview of kind of what we've went through, where we're at today, and be available to answer any questions. I'm going to handle the first part of it as far as the fire department, the emergency management part, and then Michael Mays is going to step up and help with community enforcement and some of that stuff. So obviously, in March 15th is when we had our emergency declaration. There's some points up there, kind of what benefits the declaration does for us. One of the things that I really wanted to point out, this is unique from any other emergency that we typically have. Typically, we have something happen, we have a start date, an obvious end date, and then we recover. This one is kind of, we thought we were moving from response to recovery a few months ago or a month ago, and now we're back in response. And so we're kind of, response and recovery are going together. This is a learning thing across the globe, so we're all learning as we go. But this has definitely been a learning curve that it's taken a lot of us to work through. So as far as PPE, our personal protective equipment, we've ordered 12,500 cloth masks. They should be here within the week. That was something we did a couple of weeks ago. Health and Human Services put out an offer. Hanes, the underwear company, is producing cloth masks. They were free for jurisdictions, and so we got on that early, so we should have those here shortly. My feeling is we're probably going to be in these masks for a while, so having a big supply that we can allow people to rotate through and have some extra ones is a good idea. As far as our N95s, to date, city staff has used 1,805 of the N95s. We started off with 10,000, which for a community our size is a really good supply. We've supplied 2,940 to the nursing homes. So one of our concerns going into it was they didn't have them. They have a lot of elderly population. And so while we've been encouraging them to start finding their own sources of these masks, early on we supplied a lot of masks to the nursing homes because they didn't have them. And we couldn't risk having an outbreak in those nursing homes. That would have, our resources can't handle that. So we wanted to stay ahead of that. We're really hopeful going forward that we don't have to continue to supply them. The supply chains seem to be up and running again, so they ought to be able to go to their sources and get them themselves. I think in the last month, we've only made one delivery, and that was to the nursing home, the veterans home. They came up short, and so we just ran them out another load. I believe we have at least a 6-month supply on hand based on our calculations today for city staff. A little more than that, and we have a small reserve. So I think we're in a good spot as long as we don't have to continue to supply the nursing homes. And that's going to be a part of the struggle is, and we've had with them, is the CDC's come out with guidance. In the past, an N95 mask was used one time and thrown away. When this happened, there was a shortage around the world. And so what they said is you can use them longer. They've actually even brought in devices in the valley where you can have them, it's like a big autoclave. You can throw all the old masks in and they can clean them and reuse them. Now, we're not at that point, but we definitely, so like our firefighters use one for two working days. Our cops use one for a week. Some of the struggles we found early on is the nursing homes weren't working with us in that way. They were using them single use, throwing them away, and burning through them at a rapid pace. So we think we've corrected that, kind of slowed them up on that area. But I think that's where some of that early burn rate was going through pretty rapid. As far as other supplies, gowns, goggles, we're staying up good on those too. We've recently reached out to our logistics manager to order some more gowns, just because we go through a lot of those. It's essentially a really cheap garbage bag. You know, they're really thin, you can't reuse them. So there's some more expensive options where you can reuse them, but then you have issues with cleaning and some other things. So the disposables is an easier way to take care of that. Increasing patient counts. So we've seen our counts. We were really stable for a while. We had about 30 total cases in Boulder City. Over the last probably 6 weeks, we've seen that more than double. So we're at between 70 and 83, depends on who you talk to. So the health district puts out a chart that you can see, and it has a number 83 in it. Myself and 7 other people in the valley actually get a list of names and addresses that we were able to flag for our responders, and there's 70 names on there. So that's the list that I go by. That's actual names, and that's people that from May until today have been positive. So a lot of those people have already been positive, went through the process, they're healed back up, and they're not still in that. So on a given day, we probably have 30 in Boulder City. Not that it really would change anything that we do, but we still keep track of those addresses through the whole event. One of the things that we want to really push is we all have to be diligent going forward. Whether people like the masks or not, that's how we're going to get through this. So the governor has certain directives that we're trying to enforce, and the Southern Nevada Health District has directives. We're really trying to follow those as much as we can, and we'd really encourage anybody watching this or listening to this to just heed that. If we could all come together and do that, we'll get through this faster. But if we continue to have non-compliance issues around the state and the country, we're going to continue to be in this longer and longer. So while these aren't comfortable, I'm sure that they'd be a lot more comfortable if we only have to wear them for a few months versus forever. So, and then reiterate too that social distancing and hand washing, they still go back to the masks are important, but hand washing is still the most important thing that they've come up with, is washing your hands regularly. So we'd like to see people continue to do that. So community testing, and this is one thing where I want to stop for a second, and I really want to call out city staff. We don't have a big city staff, and for the amount of work that's been required, I've been impressed, all the way from the city attorney down to our brand new firefighter. Anything that we've needed, police department are volunteering at all our community testing. We've got the hospital volunteering at our testing. We've got the parks department taking all of our reservations. There's days when that's all they do is answer phone calls. So everybody in the city's rallied together, and I honestly have not heard one person complain about all the extra work they're doing. So I've been really impressed with that, and I just want to make sure that, and I'm sure you understand too, but I think they deserve at least a mention there. So we have up here, and when we did this, we estimated about 1,250 tests that we had done so far. That's the beginning of this month. We now are doing testing 2 or 3 days a week, depending on the different organizations. So every Tuesday, we test. We're testing the community. Those have been filled up every day, and so I think we maxed out at about 170. We've had a few people trickle in. We've had some people with special cases. They're traveling, or they've have someone sick in their house. On those cases, we're not turning people away. We're trying to make sure that we're meeting those needs. We're doing city employees every Wednesday. We do have emergency aid. We had offered them a testing a couple of months ago. They finally decided they want that, so we're going to do that this next Thursday and the following Monday. So in the next 2 weeks, we'll be doing 3 days a week. We'll be doing testing. Some additional testing is the State Patrol reached out to us for the Southern District. They couldn't get anybody to do their testing for their troopers in Southern Nevada, and so we've offered to do that testing. So now we're doing all the troopers also, and so our workload. I mean, we're testing every day, and I know there's been some frustration on some of the people that get tested. It's taken a week to get the results. Part of the struggle is the district. I believe the goal was to test 30,000 people a week. They're testing 66,000 a week. So the testing is really ramping up, which is great, but it has the test results are taking longer. They used to be a day or two, and now they're taking about a week. And so it's just taking longer. It's not that we're not getting back to them. I have one firefighter that's almost all he does right now is just makes phone calls, a couple hundred a day. And again, and because it's health information, he can't leave a message, and he can't give it to a wife or a son. He has to give it to the individual. And so trying to track down a couple hundred people, it's just been challenging. So we're going to continue to do it. The health district does have a website that's helping out a little bit, because people can get that a little faster if they check themselves. But if you do get calls that people aren't getting them, have them reach out to us and we'll see if we have them. But again, it might just be that the backlog. So let's see. So as far as going forward, our EOC is currently a level 3, which is normal operations. The people that we have that staff our EOC are EOC managers, Michael Mays, Dennis Porter, Keegan Luttrell, and Brent Spire, the police commander, and Tim Shea. We still meet when there's an issue that comes up. We can have it ramp back up tomorrow. It's not like it's a big deal for us now that we have it in place. So as the need rises up and we start seeing those numbers continue to rise, the state reached out today and they're starting to talk about med surge again and getting the hospital capacities built back up. So if that kind of stuff starts to ramp up, we'll be able to ramp it right back up and go back to the next level. But right now it really comes down to, we have so many things going on. It's just those meetings are competing for testing or for other time, and so we're just trying to find a way to balance it all out. So our continuity of operations plans, it's something that when we got here, when this first hit, all the departments came together and we built continuity of operation plans. Those are still in place. If for some reason this event starts to take people, more people get sick, if the PD has 8 or 9 officers get sick, there's a plan in place to how they change their shifts and how they operate. None of that's went away, so that's all still in place, and that'll be in place for the future. That'll be part of our emergency operation plan. We have preset trigger points. So for instance, if there's utilities department's been deemed really essential, and so there's trigger points where if people get sick in there, or a certain number of people get sick in the city, where they can rotate their staff so they have half working at the same, split them so they're not all working together. If we lose all of our linemen, that's a big deal in our city because we need people to run that. So we've got plans in place for all of that. We continue to engage with Clark County, with the MAC. There's policy meetings periodically, probably 2 or 3 times a month. Those calls that we're on, there's the MAC meetings, and then our logistics team has a meeting. I believe Michael Mays is on meetings, so there's meetings all through the month on the different processes. So everything's still going on. And then the last big thing for our citizens is the communications. Lisa LaPlante's been doing a really good job of whenever there's a new website or there's new information, is posting it on the city website. And so I would just encourage anybody that has questions, maybe to let that be their first place they go to, is go there and see if it's available first. And then if not, feel free to reach out to the fire department or the other city departments that can help with that. We're happy to answer that. So I'm going to turn it over to Michael real quick, and then I'll come back up for questions.
Thank you, Chief. Good evening, Mayor and members of City Council. So wanted to touch base on one of the other aspects. The Chief mentioned it early on in his presentation, recovery efforts. You have a disaster, and then the next phase is recovery. Unfortunately, we're dealing with the disaster and the recovery at the same time. But traditionally with recovery efforts, there are 6 areas of focus. With respect to COVID-19, though, the first 4 are the only 4 that are being focused on because of the nature of the disaster. They are community planning and capacity building, economic recovery, health and social services, and disaster housing. The county, in working with all of the jurisdictions and other government agencies, has established these, what we refer to as RSFs, Recovery Support Functions. These task forces have representatives from each municipality. I serve on 2 of these RSFs, and the objective right now is to develop recommendations and action items which will eventually be reported to the elected representatives of the county and the municipalities in Clark County. This effort will be occurring over the next couple of months. Part of what the EOC has been working on is the reopening plans, and that is both how internally employees function and operate, as well as our interaction with the public. Obviously, safety is paramount, and so that has been the consideration in development of these plans, following the roadmap to recovery for Nevada and the phases that the state has identified. The city has evaluated those guidelines and developed local action plans for reopening. With respect to business compliance, some of the efforts that the EOC has been involved in is whenever additional guidelines are provided by the state, provided by the Southern Nevada Health District, one of our important roles is to make sure that that information is conveyed to our business community. Working with the chamber, direct emails to those businesses with this information. That's a role that Rafi Fasekjan, our Economic Development Coordinator, has been supporting the EOC on. Along with the information, it's also answering questions to clarify the guidelines for those local businesses and reinforcing that with particularly our police department and our chief of police and Commander Spire have both been very much out in the community, working with businesses, helping them understand the compliance and requirements for them and their employees, as well as the patrons of their businesses, and following up with complaints or concerns. We would encourage anybody that has any concerns to use the city's C-Click Fix to identify that concern, and through our code enforcement officer as well as the police department, we will follow up with that concern and that complaint. With respect to business outreach efforts and support, the EOC has been working on several efforts. Obviously, the chief has talked about some of our information to get resources into the community and to our businesses as needed. I've already talked about the on-site businesses, but early on in the pandemic, city staff made a point to go directly to each restaurant within the community, because that was one of the businesses that was able to open early to make sure that they understood the regulations and guidelines. Another effort that we worked on with the closure of the library, One Stop Career Center was not able to continue to serve their clients in person. And one of the concerns was that some clients may not have access to the internet and or computers. And so working with One Stop, we were able to set up a temporary facility to be utilized if clients requested it, so that clients that are looking for job opportunities wouldn't be at a disadvantage without access to those resources. We also, with the city, have approved business license relief. That included 2 months discount on the annual fee, again, trying to support the local business community during the crisis. Boulder City is well known for its volunteers and its generosity. And our citizens really stepped up during this pandemic. And I'm very proud to say that we had over 70 citizens sign up to help however they were needed with the COVID response. Over 250 hours of volunteer time so far from these citizens, and I want to thank them very much for their contribution to the community. They've helped in many ways, including support to the senior center and lend a hand for volunteer needs and call-outs. Our citizens not only helped with collection of donations that benefited emergency aid and senior center, but they also contributed, and so we thank them very much for their generosity. The citizens' volunteer efforts helped with our community phone bank. This was an ambitious objective to contact every household in the community, over 5,000 phone numbers in which our volunteers called citizens to check in on them, to remind them of the information available to help answer their questions and to check on any needs. As a result of that outreach effort, that resulted in additional volunteers responding to some of those needs. And a perfect example is with the police volunteers providing food delivery to those who could not leave their homes or were concerned about leaving their homes. And so that served a great need. And so we really appreciate their efforts with respect to that. And so we will answer any questions you might have.
Questions or comments? Councilmember Folda?
Thank you, Mayor. I just want to thank you, Michael, and you, Captain Gray, for all the work that you've done. I know this is probably a lot longer than we thought this would go on. And just thank you for being responsive for my requests on community testing and when that would take place. And it's good to hear that the community is using those and gives us reason to continue them. And just wanted to acknowledge all the efforts of staff and volunteers in trying to make the best of the situation. I had a question. I haven't heard any more from our golfers. They seem to be happy as the city has found a way to reopen the golf courses. However, our children are still eager to be able to use the play structures again. Staff was very responsive, and my questions about getting the splash park open, there was just a little bit of delay, not because of the phase, but because of a project that was, happening there. But I just want to report that many families are very, very glad that that's open again, and it gives a place for us to go outside. But I am still receiving, and I just want you to know that I'm still receiving input from the community questioning about when our play structures could be back open. It's my understanding it was not so much about the phase, but about our city's ability to comply with the cleaning of the structures themselves. If you have any more to add on that, I'm not sure. Just for the public to know kind of where we're at with the playground structures.
Sure. We can have our Parks and Rec Director, Roger Hall, come up and comment on that.
I was planning on addressing that in my presentation, so.
Okay. If you don't mind, we can just do it as part of that. Sure.
Councilmember Bridges?
What is the issue with compliance in terms of bars and salons? I'm not going to mention names, but it really disturbs me to walk into a restaurant and see service staff not wearing a mask, or to walk into any kind of salon and see employees not wearing masks, and they're uncomfortable, they don't like it, I've got allergies. Are they required? Is there, I know public places, but if you go into someone's place of business, are the employees required to be wearing masks?
Yes, they are. And one of the ways that we've approached with compliance and response, obviously when we receive complaints, that is where police department staff and our code enforcement have followed up to first remind them of their obligations, and if they still do not comply, we're working with OSHA, and OSHA is asked to follow up with enforcement.
Yeah, it is disconcerting. And then I heard the story about a customer refusing, and one of our businesses deciding to close their dining area because they are concerned about customers coming in who aren't wearing masks.
One of the ways to help local businesses, and this was with the most recent communication to them, is sharing some of the posters that have been created to remind patrons that to enter that business, they need to be wearing a mask.
Okay. Thank you. And we're still at about 84 cases, is that?
So like I said before, 70 is the amount of names that I have. So we're not sure why there's a difference. So one of the schools of thought is if you go in and get tested and you get retested and both times you're positive, it counts as 2. Again, it could be people that are pending. I have 70 names and addresses that go with them in the city, and that includes the Veterans Nursing Home. So all of those, that's what we have is 70. And again, that's the total from March when this started, or when we really started keeping track, through today. And so a lot of those, or at least the early ones, should have already went through the weeks or a month or whatever, how long, everybody's different, to get better and to be free of it. So I'm guessing, like I said, about at any given time, we probably have 30 or 40 people that currently have it in the city. But again, once they get a positive test from our testing, the health district contacts them. In fact, we still get the results, but the health district contacts them first, and they begin the contact tracing right away. And so as soon as they identify, person A has it, they call them, they find out where they've been, they find out who they've been engaging with, and they start to work that trail back and make notifications. And so that's becoming more and more robust. When we were on a call yesterday, I was on the policymaker call in Dr. Lagoon, and they were talking about that, and they've been working harder to try to streamline their processes a little bit to where they can do a better job with contact tracing. But again, it's such a big thing. Typically in the disasters, you have a city or a region. You don't have the world have it at the same time. So it's just really been a strain on everybody.
Yeah, it's concerning because I get to a point where I didn't know anybody, and now I've got, somebody calls me and says, my kid was exposed, or a friend has their spouse was positive, and it's sort of creeping closer to.
And in theory, as soon as they get told, they're supposed to quarantine. Again, I don't know if they enforce that, but they're supposed to quarantine. And then if I could, one more thing back on the compliance. When we started this, our understanding was Nevada OSHA had 2 inspectors in Clark County area. I think they now have a couple of dozen, and so they've added a lot more. And so where we start off with that, we educate, we inform, we warn. We have spoken with OSHA specifically. There was one business that had gotten repeated complaints, and then OSHA has gotten involved, and that's been remedied. And so with businesses, we have a lot of ability there. When people are upset about people walking down the street without a mask on, there's nothing in the governor's directives that we can do other than, again, if they're not in family groups, which is kind of hard to determine, is to try to educate. If it's a big group, to just try to remind them that you should have a mask on. But it really is, he hasn't really addressed that in his directives as best as we can see. So that's where that responsibility really comes on individuals. And same with the businesses, that people aren't wearing them. We would really encourage them to ask them to put one on or step out of the business. I mean, because that would help, but at the end of the day, we need people to take some individual responsibility too, and just, whether you like it or not, just put it on. And that'll again, that's going to help us through this.
Councilmember Adams?
Thank you, Mayor. I'm happy that Councilman Folda mentioned the issue with the playgrounds, because I too have been hearing the same thing and was also planning on discussing that. So I'm happy to hear that will be addressed in the next presentation for the parks. One of the things that you were touching on as far as compliance is when the governor gives these directives, a lot of times there's maybe a little bit of confusion or not total clarity on exactly what some of the language is. Sometimes it is just because of that, because the language might be a little ambiguous. There's also the matter of there's obviously a lot of misinformation also going around out there with what people have to comply with, what people don't have to. But at the end of the day, we as the city are going to be the ones responsible for enforcing these directives. So ultimately, we do have to determine and decide, what is it that is expected of us as a city to enforce, and what we as a city expect out of the businesses and our community to address these issues. So how is it that we as a city come to determine what it is that we are expected to do and what it is that we are expecting others to do to get us out of this problem?
So the way I understand it, the governor makes a directive. Obviously, he's consulted with staff. Then I think the Attorney General helps determine what the enforcement action will be at their level. But then, like Chief Shea then has to take that and see where we can apply our codes and ordinances and different rules to use that, because sometimes they don't put an enforcement mechanism. Early on, the enforcement mechanism really was OSHA, and when they had 2 inspectors, it was really challenging. So I believe the new one, there's more that they can do, but it's still a challenge of a balance between, do you shut down a business because one person doesn't have a mask on, or do you drag the person out? I mean, it's trying to find a reasonable way to deal with it. And so it's been a challenge, but it seems like Chief Shea's come up. I know they're doing weekly compliance checks now, where they do their checks, they write down what they find, and then they send it to the Clark County, and then they're trying to compile that. I know the county's working really hard to try to keep things open, and so they're doing everything they can. And I think I said our police department, our code enforcement, they're trying to work within that law. Again, sometimes it's just really vague, or it'll get thrown into a kind of a generic law, and so it's kind of hard to apply the problem to that, and that's just where the struggle's been. So really, it's been, I know there were some jurisdictions that passed specific rules for coronavirus enforcement, that might have made it a little bit easier, but then that'd be Chief Shea's area to speak on, to be a little more specific on how we can do that differently.
Yeah, thank you.
Councilmember Hoskins?
Well, yes, I'd just like to say thank you to the EOC and everything that you've been doing, and thank you for allowing me to be part of the community phone bank. And I think you answered my question. I was going to ask about tracing, but you, I think, touched on that. So.
Yeah, and we'd be remiss not to mention that one of our main volunteers that probably called the most people was Councilwoman Hoskins. So I know you called a lot of people. And I will say, too, that phone bank directly saved a life. And so they reached out to somebody. They found out one of the neighbors was not doing well when they got there. He was very sick, and he couldn't make it to the phone. And He did end up he was one of our early cases of coronavirus, and so he would not have made it to a phone. He was that ill. So that community phone bank, that group of people actually did save a direct save right there. So not to mention there was a lot of people that were really grateful to have a friendly voice on the other end, just talking to them. They hadn't heard from people, they were scared. And so the volunteers did a tremendous amount of help early on in that process to help alleviate some of that fear.
Thank you.
You know, I asked for this briefing to be done primarily because what we're seeing, and as what was made clear, you made reference to the Regional Policy Group phone meeting yesterday. We're not headed in a good direction right now. And, you know, it is always so pleasing to see the way Boulder City does come together, not just our employees. You know, our employees stayed on the job throughout all of this. They've been fantastic to make sure that services are provided, increased levels of response are provided, but our citizens as well, our residents, you know, I do Meals on Wheels once a week. They had people volunteering to deliver the food, lend a hand. Also, you know, people were calling them up saying, I'm available to do this. The response from our community is always fantastic, and just can't thank people enough for that. I see where we're at now. And again, it appeared that, as you said, you know, numbers started to go down, reopening guidelines were issued. And if you look at where we're at right now, and you consider that the reopening started around the beginning of June, the numbers are going in a very bad direction right now. The number of positive cases, the number of hospitalizations, it's not in a good place. You know, when you look at Arizona, which is right next door to us, some of their hospitals have already reached capacity. They're talking about that potential being here in Nevada within 2 to 3 weeks. So somehow, in addition to our initial response, we're going to have to find a way to live with this thing, it appears, for some period of time. So that's not just wearing the mask, hand washing, all the things that we should be doing. But as a city, I think we need to take a look at, you know, I guess what I'm getting at is we can't ask people to go above and beyond all the time, because that's just beyond human ability to do. So my concern is that we find ways to either look if we need to add resources, or how we can keep our employees, our residents, from being overtaxed in this, if that's possible. The testing that's being done, again, that's great. I recognize that one of the problems with that is we're doing an awful lot of it, you know, person to person. In other words, a person has to call, they get an appointment. Depending on the test results, there's another call involved there. I know Mesquite, for instance, has on their city website the ability for a person to make their own appointment. And I think that helps a great deal because, you know, they know what their name is, how their name is spelled, what their phone number is, all that. So you don't get any problems doing that. It also then allows for an electronic response to that person rather than, as you say, you know, if one of your firefighters calls, they can't get a hold of the person, they're going to have to call back until they get that person. So I just would like to see if there are things that we can do as a community, unless we see where it's like, well, okay, in 2 months, we're not going to have to worry about that. Unfortunately, that does not appear to be the case, at least at this point in time. And if we continue to have the situations we have, it's going to make the economic recovery that much more difficult and certainly that much longer. Governor just had to issue new guidelines. Bars had to close down again. You know, we just can't function by having to do this. So we need to get better, I think, in how we can get the numbers down as far as we possibly can. and how we can react to this in the best way possible. I know for some folks, you may not know all of the details, and I'm certainly not going to go into them tonight, regarding the disbursement of money from the federal government to cover expenses for this. That's a long tail here in Clark County, but there has been an agreement arrived at now, and so we should have some funds available. I think we need to look at how we can best use those funds for the long term, because unfortunately this does appear to be a long-term situation right now. So I appreciate everything everyone's done. Chief Gray, I know you started here just about the time that this all happened. I appreciate the work you've done, Mr. Mays, getting volunteers together, all of that. But what I'm concerned about is, you know, none of us are superhuman, and so we're going to need to look for ways to make this a little more routine, because it seems it's going to be with us for some time. I think the planning and execution that's been done has been outstanding so far, but it seems to me that the situation has now changed some. And so instead of reacting to an emergency, we're reacting more to a way of life, at least for several months to come. So that would be my only goal out of this meeting, is that we all start thinking longer term on this rather than reacting to a single event. We understand that this is going to be very long term. You know, the school district has announced a plan, I guess, if we want to call it that, regarding schools in the fall. Well, you know, it doesn't appear that they're going to be opening full time in the fall. So those are all the types of things I think we need to start considering now, because if we can't get these numbers to turn around, if people won't actually take some responsibility, we're going to have to spend much more time responding to this. But again, I do sincerely appreciate all the work everybody's done, not just city staff, all our residents, everyone else who has helped out so much on this.